Judge Leslie Isaiah Gaines, founder of the No Sodium Soldiers, here in Cincinnati, Ohio, talking with Dr. Keith Melvin, who I have asked to be drafted as the Surgeon General of the No Sodium Soldiers, the no-so-so, that is spreading all over the country, but starting here in Cincinnati. Now, I've known Dr. Melvin for many, many years, but Dr. Melvin, if you would, give us your practice, your background, so our friends around the country and the world will have more information of you as a physician.
I'm Dr. Keith Melvin, practicing internal medicine in Cincinnati for the past 27 years. Trained at the University of Cincinnati College of Medicine and did internal medicine training at Jewish Hospital here in Cincinnati. Have lectured extensively on hypertension and diabetes and the metabolic syndrome around the country through many, many hospitals, and do a lot of work here in Cincinnati. Had several radio shows and been involved in community activists to try to reduce the cardiovascular morbidity and mortality here in the Cincinnati area. Now, the judge here is, of course, a great example of what we have been doing. Number one, the judge, if you will, has hypertension, has cardiovascular disease. Both of these two things probably could have been prevented, perhaps, had the judge been more proactive in his younger years. Now, he has developed congestive heart failure. He has has had a heart attack, has had a previous stroke, and has had some chronic renal disease. But the judge has had hypertension for a long time, and we have battled through the compliance issues with him. Certainly now he has realized, because of these diseases, that he should not have been shaking salt on his food when he was younger, or even at all. And certainly that is the truth, I think, in terms of hypertension. Sodium. Sodium is the element that is the common denominator for the development of cardiovascular disease, renal disease or kidney disease, and cerebral vascular disease or disease of the brain. Now, hypertension is the foundation for these diseases, and the judge has had hypertension finally under control with multiple medications. In the African American community, it is very clear through all the studies that African Americans on average require 3 to 4 drugs to control mild to moderate hypertension. Now, what is important about controlling mild to moderate hypertension? Well, it is what the judge has seen as a result of not controlling it. That is the development of the heart disease. And so we want to make sure that people in our community understand that clearly we must not shake salt on our foods when we're at the table. Yes, we can cook with some, but we need to learn to use sodium substitutes. No question about that. We need to have our children not shaking salt. Get the pepper, change the flavors, use onions and garlic and other types of substances to change the flavor for what we're looking for. Hypertension is a problem in our community. Clearly it is a silent killer because you don't feel your blood pressure rising, you don't necessarily have a headache, you don't necessarily have any chest pain, you don't necessarily have swelling in your ankles or legs. You just have high blood pressure, and you wouldn't even know it had you not stuck your arm in a sphygmomanometer and had your blood pressure checked. I recommend to people all the time, if you're walking through the grocery store somewhere, have your blood pressure checked, because it might be high without you knowing it, and if you find it is high, then you should seek the recommendations of a physician and have further evaluation. Make sure about these kinds of things. We in our community have to learn to be proactive and not reactive.